Good morning, and thank you for spending a little time with me today. If you're listening quietly right now, perhaps with a cup of tea nearby or sitting somewhere familiar and comfortable, you're exactly where you need to be. As we move past 60, many of us start hearing the same messages repeated again and again. Look after your heart, watch your blood pressure, manage stress, eat well, stay active. All of that matters, of course. And most people watching this are already trying to do those things. Yet even when we're doing our best, there's often a quiet feeling that lingers in the background. Not panic, not fear, just a low, steady question. You might find yourself thinking about your heart more often, or noticing your blood pressure readings, or simply feeling that your body doesn't respond the way it did a few years ago. And usually there's one very familiar part of the picture that doesn't get much attention at all. Not unusual treatments, not rare conditions, just the medications you take every day. The tablets that have slowly become part of your routine over the years. This conversation isn't here to alarm you. It's not here to tell you to stop taking anything. And it's certainly not here to suggest you've done something wrong. Instead, this is simply a quiet conversation, a chance to slow things down and look at how the body changes after 60, and how those changes can subtly alter the way medications affect the heart, circulation, and overall well-being. Many people are never invited into this kind of discussion. Prescriptions get renewed, symptoms get brushed off as just part of aging, and life moves on. But understanding brings calm. And when we understand what the body needs now, at this stage of life, we can support it without fear or urgency. So today, let's take a gentle approach. No pressure, no warnings, just a conversation to help things make a little more sense. One of the quiet misunderstandings about aging is the idea that if something feels different, something must be wrong. After 60, many people carry an unspoken sense of guilt about their health. Maybe I should have exercised more. Maybe I should have eaten better. Maybe I waited too long. But the body doesn't work like that. What changes with age is not whether the body works, but how it responds. The liver still does its job, but it processes substances more slowly than it once did. The kidneys still filter the blood, but they're less precise with fluid and minerals, even when blood tests look normal. And the heart and blood vessels become more sensitive to shifts in pressure and volume. None of this means failure. It means adaptation. Something that felt completely fine at 45 can feel heavier, stronger, or more draining at 70. Not because it suddenly became harmful, but because the body now needs a different rhythm and wider margins. Think of it like this. Walking briskly might have felt effortless years ago. Now a steadier pace feels more natural. Not weaker, just more considered. The same principle applies inside the body. This matters deeply when it comes to medication. Many medicines are started at a time when the body is more resilient. They work well, they help, so they continue. Years pass. The prescription stays the same, but the body does not. And this is where confusion often creeps in. If I've been taking this for years, it must still be right for me. But time itself changes the context. The issue is rarely that you're taking the wrong medication. More often, it's that the body receiving it is no longer the same body. And this is the most important thing to hold on to. The problem isn't that you took something wrong. It's that your body has changed. And it now needs a different kind of support. That understanding alone allows many people to breathe out. One of the most helpful things to understand at this stage of life is that medications rarely work in just one place. We often think of a tablet as having a single job, something for pain, something for sleep, something to steady blood pressure. But inside the body, medicines move through shared systems. They pass through the liver. They are filtered by the kidneys. They influence fluid balance, blood vessels, and nerve signals along the way. In younger bodies, these systems are more forgiving. They adjust quickly. They clear substances efficiently. Small shifts often go unnoticed. After 60, that flexibility becomes narrower. The body is more likely to hold onto fluid. Blood pressure can shift more easily, even without changes in diet or activity. Heart rhythm and balance can become more sensitive to signals that once felt neutral. What makes this challenging is that these effects are rarely dramatic. There is usually no sharp pain, no clear warning sign, no obvious moment where something suddenly goes wrong. Instead, the changes are quiet. You might notice your ankles feeling heavier by the evening, blood pressure readings that slowly creep up or down, a sense of tiredness, lightheadedness, or unsteadiness that's hard to explain. Because these changes happen gradually, they're often attributed to aging itself. And sometimes that's partly true, but often it's not age alone. It's how age changes the body's response to medication. This doesn't mean medicines are harmful. Many are essential and genuinely supportive. What it means is that after 60, the margin for unnoticed side effects becomes smaller. The heart, in particular, feels these shifts early. It responds to changes in fluid, pressure, and rhythm long before obvious symptoms appear. This is the first quiet aha moment. Not this medicine is bad, but rather, this medicine may now be asking more of my body than it once did. And that understanding prepares us to look calmly at specific medication groups, without fear and without blame. Let's begin with a group of medications that almost everyone recognizes. Pain relievers such as ibuprofen and naproxen. They're familiar, they're easy to access, and for many people, they've been part of daily life for years. A stiff knee in the morning, a sore back after gardening, arthritis that flares from time to time, reaching for one of these tablets often feels routine, almost harmless. And for short-term use, in the right situations, they can be genuinely helpful. The part that deserves a second look after 60 is not the pain relief itself, but how these medications interact with the body over time. These medicines don't only quiet pain signals, they also influence how the kidneys manage salt and water. In a younger body, the kidneys adjust quickly. Extra sodium is released. Fluid balance is restored without much effort. As we get older, even healthy kidneys become less efficient at fine adjustments. When certain pain relievers interfere with that process, the body may quietly begin to hold on to salt, and water follows. This doesn't usually feel dramatic. You might notice your shoes feel tighter by evening. Your legs feel heavier at the end of the day. There may be mild swelling around the ankles that comes and goes, or a sense of tiredness that feels out of proportion to what you've done. Many people assume this is simply part of aging, and sometimes it is, but often it's the circulation responding to extra fluid. When the body holds more water, the heart has to work a little harder. Blood pressure may edge upward. Everything feels slightly more effortful, without a clear reason why. This is where the aha moment often happens. Not because anyone was doing something wrong, but because no one ever explained the connection. Using these medications occasionally is very different from using them daily. Taken every day, especially over long periods, they can quietly add load to the kidneys and the heart. particularly in people who already keep an eye on blood pressure. This isn't a message to stop anything suddenly. And it's certainly not about living with untreated pain. It's simply an invitation to pause and ask gentler questions. Do I still need this every day? Could it be used only when pain truly flares? Is there a different approach that might suit my body better now? Sometimes the answer is just a small adjustment. Sometimes it's exploring topical options, movement-based support, or reviewing the plan with a doctor. After 60, medication choices are rarely about strict rules. They're about fit, and pain relief, like everything else, deserves to be looked at with the same calm attention we give the rest of the body. Let's move now to a different group of medications, ones that many people over 60 rely on quietly and often gratefully. Medications for sleep and anxiety. If you've ever struggled to fall asleep, stay asleep, or calm a restless mind late at night, these medicines can feel like a relief. They help the body slow down. They take the edge off worry. They make rest feel possible again. And it's important to say this clearly. For some people, at certain times, they are genuinely helpful. The part that deserves more attention is what they ask in return. These medications work by calming the nervous system. That's why they help with sleep and anxiety. But the nervous system doesn't only manage thoughts and emotions. It also controls balance, reflexes, coordination, and reaction time. After 60, those systems already have less margin for error. When they're slowed further, even gently, the effects can begin to show up in everyday moments. Standing up at night to go to the bathroom, turning quickly without thinking, getting out of bed in the morning. Movements that once felt automatic may now feel slightly delayed. And after 60, that small delay matters. This is where we need to be very clear. A fall after 60 is no longer a minor inconvenience. It can mean fractures, hospital stays, loss of confidence, and sometimes loss of independence. What makes this especially tricky is that the connection isn't obvious. People may notice feeling a little foggier, a little less steady, more cautious when moving, and they often assume this is just aging. Rarely does anyone think to ask whether a sleep or anxiety medication might be contributing. There's also the issue of dependence. Over time, the body adapts. The medication may feel less effective. Stopping suddenly can feel uncomfortable or unsafe. So the message here is very important. This is not about stopping anything abruptly. That can be dangerous. Instead, it's about review. Revisiting whether the medication is still needed in the same way, whether the dose still fits the body you have now, whether alternatives or adjustments might offer the same comfort with less risk. After 60, medications for sleep and anxiety are not just about rest. They're about safety, balance, and staying confident in your own movement. And that makes them worth looking at calmly and regularly, rather than leaving them unquestioned. Let's talk now about a group of medications that many people take so regularly they almost fade into the background. Medications for stomach acid and reflux, often known as proton pump inhibitors or PPIs. They're commonly used for heartburn, indigestion, or reflux discomfort. And when symptoms are severe, they can be genuinely helpful. They reduce stomach acid, calm irritation, and allow healing to begin. That's exactly what they were designed to do. The part that often goes unspoken is what happens when a short-term solution quietly becomes a long-term habit. Stomach acid isn't only there to cause discomfort. It plays an important role in helping the body absorb key nutrients, especially calcium, magnesium, iron, and vitamin B12. When acid levels stay low for long periods, absorption can slowly decline. Not suddenly, not dramatically, but gradually. Over time, this can begin to affect bone strength. Calcium that isn't absorbed doesn't support bone density. Muscles may feel weaker. Energy may drop. Low vitamin B12, in particular, can show up as fatigue, a sense of heaviness, mental fog, or subtle balance changes, symptoms that are very often explained away as just getting older. And because these changes happen slowly, the medication is rarely questioned. The key point here is not that these drugs are harmful. They are not bad medications. It's that they were designed for short-term use. Yet many people continue taking them daily for years without review. After 60, everything in the body is more interconnected. What affects digestion can influence energy. What affects nutrient absorption can influence bones, muscles, and even heart resilience. So this is not about stopping suddenly. It's about curiosity. Asking gently, do I still need this every day? Could the dose be lower? Are there other ways to manage symptoms now? Because after 60, the most supportive care often comes from reassessing routines that once made sense and adjusting them to fit the body you have today. Heart and blood pressure medications deserve special care in this conversation, not because they are dangerous, but because they are important. For many people, these medicines have been genuinely life-saving. They reduce strain on the heart, they protect blood vessels, they lower the risk of serious events. So let's be very clear from the start. This is not about mistrusting heart medication, and it is absolutely not about stopping anything on your own. What matters here is understanding how the body changes after 60. As we age, blood vessels naturally become less elastic. The nervous system responds more slowly to changes in posture. The kidneys manage fluid and electrolytes with less margin for error. Because of this, a dose that was perfectly balanced at 50 may feel very different at 70. Sometimes heart medications continue to work exactly as intended. They lower blood pressure, they slow the heart rate slightly, they reduce workload, but in an older body, that same effect can occasionally become too much. This is when people begin noticing things like feeling lightheaded when standing, a vague sense of fatigue that wasn't there before, mental fog, or a feeling of being slightly off without knowing why. These sensations are often explained away as aging, but sometimes they're signals that the body is receiving more pressure reduction than it currently needs. Blood pressure that drops too low can reduce steady blood flow to the brain. A heart rate slowed too much can affect energy and balance. Fluid shifts can increase fall risk, especially with sudden movements. None of this happens dramatically. There's rarely a sharp warning. It shows up quietly. And because the medication has been trusted for years, it's rarely questioned. The most important message here is this: the medication isn't wrong, and you haven't done anything wrong. The body has changed. Heart medications are not static tools for a static body. They work best when they're revisited from time to time, reviewed gently, and adjusted with attention to how you actually feel, not just what numbers say. Sometimes the best care is not adding more, but recalibrating what's already there. In the next part of our conversation, we'll look at what happens when several medications are taken together, and why the combination itself can quietly become the real issue. There is one reality of later life that often goes unspoken, even in medical settings. Many people over 60 are not taking just one medication. They're taking 5, sometimes 7, sometimes 10 or more, and this has become surprisingly common. A tablet for blood pressure, another for cholesterol, something to help sleep, something for pain, something for the stomach. Perhaps a few supplements added along the way. Each medication may have been appropriate at the time it was prescribed. Each one may still make sense on its own. The concern isn't any single pill. It's the total load the body is asked to manage every day. As we age, the liver processes medications more slowly. The kidneys filter less efficiently. The nervous system becomes more sensitive to chemical signals. When several medications are taken together, interactions can occur quietly, not dramatic reactions, subtle ones. Feeling more tired than usual, a sense of mental fog, reduced balance, less motivation, occasional confusion. These symptoms are very often dismissed as, "I'm just getting older." But sometimes they're not aging at all. They're the body struggling to keep up with complexity. Another challenge with polypharmacy is what's called a medication cascade. One drug causes a side effect. That side effect is treated with another drug. Over time, the original issue becomes harder to see. None of this means medication is bad. And it certainly doesn't mean everything should be stopped. It simply means that after 60, more is not always better. This is often a turning point for people. Not a moment of fear, but of clarity. Many symptoms we quietly accept as just age can actually be signals that the system is overloaded, not failing. In the next part of our conversation, we'll talk about what to do with this understanding, how to review medications without pressure, without fear, and without giving up the protection they provide. Because awareness is not about doing less care. It's about doing the right care at the right pace for the body you have now. At this point, it's important to pause and make one thing very clear. Nothing we've talked about today is an invitation to stop medication on your own. Medications save lives. They protect the heart, the brain, and many other systems. For many people, they are essential. The goal here is not fear, and it's certainly not rebellion against treatment. The goal is review, not removal. After 60, the most helpful question is rarely, "Should I be taking this at all?" It's more often, "Is this still the right dose for this body at this stage of life?" A medication review doesn't need to be complicated or confrontational. It starts with something very simple, a clear list. Every prescription medication, every over-the-counter tablet, every supplement, even the ones that feel harmless. Bringing that full list to a dedicated review appointment allows your doctor or pharmacist to see the whole picture, not just one piece at a time. The next step is asking calm, practical questions such as, "Do I still need all of these? Have any of these become too strong for me now? Could some of my symptoms be medication-related? Are any of these working against each other?" These are not challenging questions. They are responsible ones. A good review is not about taking everything away. More often, it's about small adjustments, lower doses, simpler combinations, clearer priorities. Many people are surprised by how much lighter they feel afterward, not because something dramatic changed, but because the body was finally given space to work with less strain. And that is what thoughtful care looks like after 60. As we come to the end of today's conversation, there's no final warning to give and no single rule to remember. What matters most is something much quieter than that. Understanding leads to calm. Calm creates space, and space allows us to act with clarity rather than fear. Nothing we've talked about today was meant to make you doubt yourself or feel as though you've been doing things wrong. It was simply an invitation to look at your health with a little more perspective, and a little less pressure. After 60, being proactive doesn't mean doing more. It often means slowing down, asking better questions, and allowing care to evolve, along with the body. That's the spirit of this channel. These conversations aren't here to tell you what to stop or what to start. They're here to sit alongside you, to help things make sense, and to remind you that you're not alone in navigating this stage of life. If something we discussed today felt familiar, or helped you see your own situation more clearly, that's already enough for now. You're very welcome to stay. Some people choose to give the video a like as a quiet sign of support. Others subscribe so these conversations can find them again when they're needed. There's no pressure either way. We'll keep these discussions going, calmly, thoughtfully, and without urgency. Because good health after 60 isn't about perfection. It's about understanding, steadiness, and staying engaged in the conversation. Thank you for spending this time with me. Take care, and I'll see you in the next one.